My name is Dr. Sam Sidney. I'm a fellowship-trained orthopedic surgeon that has had the benefit of being associated with Orthopedic Associates of Central Maryland for over the past 25 years. What does fellowship training mean? It means that after residency, I spent a year doing just joint replacement arthroplasty. I had the benefit of working with a wonderful surgeon in Columbus, Ohio. Since then, I have been in the Baltimore-Howard County area performing joint replacements through many different approaches. This video, we're going to focus on the indications of hip replacement, but focusing on anterior hip replacement done through an anterior approach using a Hanna table. What are the indications for hip replacement? A lot of times, pain is the first indication, but sometimes pain can be deceiving. It might not always be what you think is hip pain. So a diagnosis needs to be made. Oftentimes, that's by a thorough physical exam, and then x-rays, or sometimes an MRI. Now, just because you have hip arthritis does not mean you need to have a hip replacement. An assumption is being made here that you have failed all conservative measures. That means physical therapy, pain medications, possibly injections, and restriction of activities. So let's get on with the discussion of hip replacement. A hip replacement is an operation performed where the diseased hip joint, that is a ball and socket joint, are replaced with artificial surfaces, sometimes metal on plastic or sometimes ceramic on plastic. This operation has been performed through many different approaches. And if you've seen incisions, sometimes you see a long incision in the back of the hip, sometimes the side of the hip. Today we'll be discussing the advantages of an anterior hip replacement. The procedure of an anterior hip replacement using a Hanna table requires the use of a specialized table, making an incision in the front of the hip. Once that incision is made, the interval between these two muscles is identified and these muscles are separated. For purpose of demonstration, I'm going to take these muscles out of our view. A second set of muscles are identified, separated, and then we can work on the hip. The Hanna table is valuable because it allows us to rotate the extremity to gain access to both the socket as well as the femur. The goal of the operation is to get you up that very day. Now, with the uniqueness of an anterior hip, getting up means not having a lot of do's and don'ts, but just doing it safely with the help of a physical therapist. And then once you're safe, we essentially let you start going and starting your rehab at your own pace, guided by physical therapy. In summary, we have discussed hip arthritis and anterior hip replacement. I have performed thousands of these, and I look forward to sharing my experience with you if the need arises.